Good morning. It's day 68 of Safety 365. And I just want to cover some terms used to describe health effects. Irritation, we all know. We get a rash, that's an irritation. The skin would redden up if you get a chemical on it. It would irritate you. You'd want to scratch it. Maybe it bubbles up and causes blisters. That's not good. Asphyxiation is that you're having problems breathing oxygen. You get asphyxiated if there's lack of oxygen. And there's always organ-specific effects. Obviously, if you think of smoking, it affects your lungs. You get a solvent, it affects everything that solvent touches, from the blood to the nerves, maybe. They use terms like mutagen, and that means if you were pregnant, it would affect your fetus, and that's not good chemical to have any kind of exposure to. Teratogen means it's going to affect your genes, a negative effect on that. You're not going to become the X-Men, you're going to have probably gene damage. And we already talked about acute. Reversible means you take it away, maybe you'll be okay. Sometimes lead exposure, you commit reversible if you're an adult. Not so much with the kids, but an adult. Marcy Borders, she was caught in the 9/11 dust cloud, and, everybody was in that area. You're breathing all this asbestos, silica, and, many people died. Over 10,000 people have died in there. She had stomach issues that caused her death, and, that's unfortunate because, like I said, this is a tragedy where, not only the people who are in the area, but, the rescuers even got killed. And so we don't want to have anything like this if it's an old house, and maybe it's asbestos. We can always test, send it to a lab, and make sure it is. All right, let's be safe out there, and I'll see you tomorrow.